So welcome. Thank you everyone for coming along. This is our second special virtual meeting, and this time around we're absolutely delighted to be hosting it with Carers UK. So we have Matthew Jones with us, who is the helplines and advice manager at Carers UK, and we're going to use the session as sort of a question and answer meeting. We've got a number of questions to pose to Matthew that we know through our own support line and from talking to different people will be important questions for the carer community. But if you do have anything else to add, or if you have any questions, do please just let us know. Just either put your hand up or wait a bit, or interject, whatever works best. So first of all, for people who don't know me, so I'm Luke. I'm the head of communications at the TSA. So I help organise things such as this and do the events bits or any sort of stuff around communications. Really, it's a broad church. And as I say, I'll formally introduce Matthew here, who I don't know if you want to say a few words as well, Matthew.
Yeah, absolutely. Hi everyone, thank you so much for having me. I guess the first thing is I was a little bit nervous about coming on camera today, so I kind of braved my first lockdown home haircut the other day. So the idea of being recorded or seen by anyone in the outside world was a little bit of a difficult one. But that aside, I work for Carers UK. So we're a membership organisation supporting unpaid carers, informal carers, family carers, however you may identify yourself as a carer. And we support people through telephone support, email, social media, lots of the ways that you may get in touch with TSA. And we've really seen kind of throughout the COVID crisis just what a worrying time this has been for carers. So really pleased to have the opportunity to join you all this evening and hopefully give you some additional information that you maybe haven't encountered before, or if there are some questions once we've done the Q&A piece, happy to try and answer them, or if it's something that kind of needs a little more research, take that away and see if we can help a little more.
So as I say, this is going to be a bit of a Q&A session. So Matthew, without further ado, I'll start with the first question worked down. So the first one we've got is we're quite a way into lockdown now, a good few weeks. But it would be interesting to know if there's any key information that you still think is important around allowing carers into the home with sort of the lockdown, social distancing and things like that.
Yeah, absolutely. So we've been asked about this a lot at Carers UK actually, and I suppose the first piece of information there is that essential care visits, whether that's from a paid care worker or perhaps yourself as an unpaid or a family carer, they can continue. And there's been a lot of information on the government website around some of the safety steps you can take and hygiene steps that you can take. I guess the kind of underlying rule to that is if a carer is experiencing symptoms of COVID-19, again, whether it's a paid carer or unpaid carer going into a home, then those visits do have to stop, and then the self-isolation guidance needs to be followed from there. But thinking about carers coming into the home during lockdown, there's two main things we're being asked at the moment, and the first is around PPE, and there's been a lot in the news about this. But also if there are circumstances where someone maybe has a kind of main carer or a principal carer or the same person coming in, what would happen if that person became unwell? So on the PPE point, the government have issued guidance to care providers about the safety steps and about the correct use of PPE in different care settings. And that is on the gov.uk website if that was ever something you wanted to look at. But if you are concerned about a paid care worker coming into the home or worried, then the first step would be to speak with the care provider and contact the management and ask them if they can talk you through what steps they're taking, what policies they've put in place to keep everybody safe, both their staff and the people they are caring for. And that would also be true if you're concerned about care being disrupted. So that point of it, the main carer can't come into the home or the principal carer becomes unwell. You could also ask them kind of what contingency arrangements are in place, how they would keep that care going. And having that information can actually help, even just from the point of view of having some more information and the feelings of worry and anxiety that might go with that.
Okay, great. Thank you. I was going to have follow-up questions, but that you answered it so comprehensively. I don't have any.
Sorry, speaking too much already.
Thank you for that. So the next question actually up is what it would be good to know what the situation is now in terms of accessing respite support during lockdown. Obviously, it's something we've had quite a few questions about ourselves, and I'm sure you have also. It's such a vital area, and it's the information seems to be everywhere, so it'd be good to get a clear steer.
Yeah, absolutely. I mean, this is, as you say, there's a lot of information. It's where it gets a little more complex, if you like. You may have seen in the news talk about the Coronavirus Act, and that in itself has some impacts on local care services, respite services, and the like. So I suppose the starting point is that at present, local authorities, local councils should be doing their best to maintain care and support packages as they would normally be provided. Where the kind of Coronavirus Act comes in is if that looks like it would be unachievable. And at that point, that's when local authorities have the power to reprioritise, if you like, and alter their services and change their normal ways of working. Now, I'm not going to go through every single point of the Coronavirus Act. I don't think that makes for a very entertaining or enjoyable evening, and we would be here for many hours. But I will go through a few key points, kind of depending on what your situation might be, how the act might kind of become relevant. Yeah. And it's probably worth mentioning at this point as well, there's a charity called the Disability Law Service. They've put together a really helpful resource specifically around the Coronavirus Act and how that affects social care. So their website is dls.org.uk. So that's dls.org.uk. And I think it's on their kind of main homepage, and there's a lot more comprehensive information there. But firstly, if you currently receive a care and support package, or you have a package in place, as I said, the expectation would be that that would continue unless you've been told otherwise. And the told otherwise bit, the expectation would be that you've been sent a letter by your local authority or your local council, and they've explained why they've had to put easements or relaxations of services in place. Now, it might be the case that you have a care package, say a carer comes in to provide you with respite and that has stopped, but you feel that that could still be maintained. So we've spoken about some of the health and hygiene steps that have been put into place around PPE. So if you feel it could still be maintained, the first step there would be to speak to the care provider in the first instance and see if they're able to agree a way they can continue with that support. If you have that conversation and the answer is no, but you still believe that that care could be maintained, then the next step would be to speak to social services at your local council directly, or a social worker if you've been assigned one, and explain your concerns to them about the care package, the respite package you have in place stopping, and also ask them if this has happened because of a general relaxation because of coronavirus, or if it's actually happened specifically because the Coronavirus Act easements have been put into place formally. And kind of once you've got those answers, it's probably then a good step to get some more comprehensive advice. So that might be getting in touch with TSA, contacting Carers UK, so you can send us an email at advice@carersuk.org, or contacting, say, your local citizens advice and asking them to give you some more comprehensive guidance about how you can then challenge that decision. So that's if you currently have a care or support package in place. The flip side of that might be that you haven't received support before from the local council or social services, but you now feel that this would be helpful for your situation. And this could be the first step to asking for that sort of help. And there's a few kind of, if you like, different routes into accessing that sort of support. So the first one I would say, I mean, I don't know if it's kind of a common thing for someone with tuberous sclerosis to be assigned, say, a clinical nurse specialist or a dedicated clinician, perhaps. I don't know if that tends to be the case.
It would vary by each individual. To be honest, yeah, it's so vast that it could happen.
Okay, so if it was the case that you had, if you like, a kind of a key worker within a healthcare team or a point of contact or a clinical nurse specialist, the first step might be to contact them if you're able to, and obviously that might be tricky at the moment, and to ask them if they have any specific local knowledge about routes into accessing respite care or additional care at home. Because there are some areas where healthcare and social care, if you like, are very well joined and integrated, so they may have some good local knowledge they can share with you and help you into that process. The alternative would be to contact the social services department at the local council and ask for an assessment. So typically that is a needs assessment for the person that you look after and care for, and a carer's assessment for yourself as the carer. And this may be something that everyone in this meeting has done before. I'm mindful this is being recorded for other people as well. So if it's the case that you haven't done this, you haven't heard about the assessments, these essentially look into the additional support that may be available to you. And we do have a lot of background information on the Carers UK website, which is carersuk.org, if you kind of want some more information about how these assessments work. But the specific points at the moment with carers assessments and needs assessments in light of the Coronavirus Act is really at the point of asking for an assessment or asking for help, to ask if there are likely to be any delays or any alterations to the normal processes that you need to be made aware of. So for example, if the assessment process is going to look quite different, if there are things that you need to know about because it could be a bit more relevant further down the line. And if you are going to go through the process of asking for a carers assessment and a needs assessment, what we do say to carers is it can be a good idea, if you like, to keep a daily timetable of your caring responsibilities. So the support you're providing for somebody, and actually that the council or the local authority or social services would also be interested in is if that has an impact on your own health and well-being. So having that kind of timetable, if you like, to show to social services or to email over if you're having one of those assessments, can be a really helpful way to give a clearer idea to the council of the type of support that might be helpful for you.
Great, thank you. So it's essentially just giving, I suppose, similar to a lot of carer situations outside of COVID-19 as well. It's a case of just providing as much information as you possibly can, by the sounds of it, yeah. Absolutely.
Excuse me. Absolutely, yeah. And also being comfortable to ask questions and go back to ask more questions as well. And that's okay to do. And one of the things that we often say as well, and it sounds kind of a very basic thing, but even just if you're having a conversation, say with social services or with a social worker or through the assessment process, having a notebook in hand and just keeping notes of anything that you're being told, things that might be really helpful later on if you need to ask about, or knowing who you've even spoken to, because in the assessment process there seem to be so many kind of names of things, or you'll speak to different people with different job roles and the like. So even just those things can be a really helpful step as well.
Great, thank you. So we'll move on to the next question, and this is more about residential care and care homes as well. So the question is, do you have any tips, Matthew, on keeping in touch with loved ones when it isn't possible to visit their residential or care home at this time?
Yeah, so I think kind of technology is something that people are talking about a lot when it comes to staying in touch with people, as you might expect. So having an open conversation with the care home in the first instance about your concerns about not being able to visit the person you care for, your loved one, because care homes will be really aware of the anxieties that causes both the carer but also the person they're looking after as well.
Yeah.
So having that conversation about how they can help with technology. So, for example, some care homes I know have got tablets or iPads available to support with video calling, or can make a telephone available for someone to have a conversation with a family member or a friend. But there are also some other ideas you could explore with the care home or the residential home. So it might be, for example, seeing if you can send an email to the care home with a message and ask if they can read that out, or recording a video, for example, and seeing if that can be sent. So some of those options you could speak to the care home about.
Yeah, great, thank you. So the next couple we have, they may be quite close to home for people who are on the call, or perhaps might be viewing the recording afterwards. But it's obviously it's an incredibly busy time, especially for carers at the moment, in all settings, and it's important not to burn out. Or at least try not to burn out. So it would be good to know, because it can be difficult. I know from my personal experience, the burnout is difficult to detect in yourself. When I've gone through similar things, not as a carer, but in a different environment. Is there any particular signs or anything that might come up where a carer could keep in the back of their mind, or if they know a carer where burnout or fatigue could possibly be an issue?
Yeah, it's a really important question, and it is Mental Health Week, Mental Health Awareness Week at the moment as well, so a very relevant question. And I think as you might expect, as someone who runs a service for carers and someone who's really passionate about carers being supported, I will always kind of champion carer wellbeing and support for carers. But I also know that this is not necessarily an easy thing to do, because carers frankly are an amazing group of people, and as you might expect, and I'm sure everyone in this Zoom chat will know, your energy and your attention is very much focused on the person you are caring for, and thinking about kind of supporting yourself and how you can look after yourself is often not going to be the first thing that comes to mind. And I guess kind of what I would put forward are some suggestions about things you could keep in mind if this is something that you feel comfortable thinking about. Because equally I know that kind of thinking about kind of carer fatigue, if you like, or feeling burnt out can also be a really upsetting thing to think about. And you know, the last thing I'd want to do would be to cause upset or offence to anybody. And I guess the first suggestion would be, are you able to spend a few moments to check in with yourself, if you like, and ask yourself, how am I getting on? How am I doing? And for some people, even that might not be a doable thing. But if you are, then I think giving some thought to some certain areas. So am I able to look after my own health and my own needs? Am I supported in my caring role? Do I feel respected and valued? Am I still able to connect in some way with friends and family? Am I still interested in things that I used to enjoy? Am I feeling more stressed, anxious, irritable? And I would say the suggestion would be, if you're answering no to those questions, with the exception of the last one about stress and anxiety, that could be a sign that it would be really helpful to ask for some help or some advice. And that might be contacting Carers UK or TSA, that might be speaking with a GP, or it might be asking for an assessment like we spoke about earlier. But there's no there's no easy answer, and there's no answer that would speak to everybody's situation. And I hope that kind of is clear from what I'm saying. It's a very individual, very personal thing to be thinking about.
Yeah, no, that's great. Thank you, Matthew. And just to reiterate to everyone on the call and who will be viewing this recording as well, there's obviously Carers UK, their support line, which Matthew manages, and we also have the TSA support line as well, who are there not only for direct information about TSC related issues, but also just as listening here as well. It doesn't have to be anything more than just wanting to have a conversation with someone. So yeah, you've also preempted my next question, Matthew, which was if the carers realised that they could perhaps benefit from support themselves, where would they need it? But I think you've already surmised that quite well in terms of different support lines, GP. Was there anything else you could think of? I just want to make sure we're not missing anything.
Yeah, I mean, there are a few other suggestions that we've got on our website, and we're talking to people about through our services as well. So the first would be local carers centres and local carers organisations. Now, we don't run these ourselves at Carers UK, but on our website we do have a directory of all the carer centres in different areas of the country. And these carer centres typically have good knowledge of local services, local support services that may be available, and can also help you to connect with local carers. And some also run carer card schemes, for example, which may help in say, local shops or local areas. So that's the first area, kind of additionally, that I would suggest. The second, that some people may already be aware of, say, from letters from a GP or a shielding letter, is the NHS's volunteer responder programme. So that's the NHS volunteers who provide help with collecting, shopping, medication, and are also offering a telephone check-in and chat service. And that support is available for people who are in a shielding category, for example, but also for carers, specifically if their support is something that would help you continue in your caring role. There is a telephone number that you can ring to access that support and to ask for that help. Which is different to the automated one that was first given out kind of with the extremely vulnerable service announcement from the government. So I'll give it now, but also I'll provide it to you, Luke, so it can go perhaps below this video. This is 0808 196 3646. So that's 0808 196 3646. And that opens from 8 in the morning to late in the evening. So that's another route that you might be able to ask for some local support at the moment as well, in particular.
Great, thank you for such an in-depth answer, Matthew. That's really appreciated. We'll be sure to gather all the information that Matthew's giving, and then we'll obviously be using it ourselves as well in terms of signposting people on our website and our own support line as well. The last question I had for you, Matthew, before I possibly open up to the to participants for any more questions, was it was just to see if you had any other pieces of advice or information that you think a TSC carer would benefit from. Could be anything.
Yeah, I would say the other thing that we are talking to carers about at the moment who are contacting us, and again, this might be something that is already in place, is around the importance of having a contingency plan. So say, for example, if you were to become unwell as a carer, and that really is bringing together in one document all the really important pieces of information you would want to be aware of if you weren't able to care as you normally do. So that might be documenting, for example, key contact details of emergency contacts, details of any medication that the person you look after takes, the dosage information, actually where it is stored as well. details about ongoing treatments, contact details of healthcare professionals, and also any care and support services or care products that person receives, and advise them. And it's also an opportunity to discuss with the person you look after, where possible, if there's anything that they would really want someone to be aware of, if you weren't able to care for them as usual, anything they would really want someone to know about, if you weren't caring for them in the way you would normally do.
I'll just say, Matthew, thank you so much for being a part of this. Honestly, we appreciate it so much, and the amount of information we've got today has been excellent, and just an opportunity for everyone as well, just to get together and connect. What I'm going to suggest actually as well is, if anyone is interested in doing it, I can we can sort of note the meeting is sort of closed, but I can keep my Zoom chat running if other people would like to just to catch up a little bit and talk. If you'd like to do that, you might see that I'll go off, but you're welcome to stay on for as long as you like. But until I do that, I'll just once again say thank you to Matthew. All the information will be put on the website, and as I say, the recording will be as well. So hopefully you've enjoyed it.
Thank you.
Thank you. Thank you, Luke.
Thank you all. Bye.
Bye.